Hello everyone, I'm going to show you how to solve an ABG problem without any mnemonics, that too in a very simple way. So for that we have to know the normal range values of pH, CO2 and HCO3. As you can see, I have mentioned it all over here in the form of range, but for me I want to keep it simple, so I remember it as 7.4, 40 mm of Hg and 24 milliequivalents per liter. So whenever you talk about CO2, you have to know one thing, that it is always associated with a respiratory condition. Whenever the CO2 levels are deranged, it is associated with respiratory problems. And also CO2 is directly proportional to H plus levels. Similarly, when we talk about HCO3, HCO3 is a basic ion. So it is always, you have to remember that it is always associated with metabolic conditions whenever it is deranged. First step is look for pH. We look for pH, and if pH is decreased, that is less than 7.4, it is suggestive of acidosis. So in case of acidosis, we look for two values, which is if CO2 is increased, that is more than 40 mm of Hg, it is suggestive of respiratory condition, right? So it is a respiratory acidosis. Whereas in case of HCO3, if the values are less than 24, which is the base itself is less, it is suggestive of a metabolic acidosis condition. On the other hand, when pH is more than 7.4, it is suggestive of alkalosis. Similarly, we have two conditions. We look for CO2 and HCO3 values. When CO2 is decreased, that is less than 40 mm of Hg, is suggestive of respiratory alkalosis. And similarly, when we go to HCO3 values, when it is increased, that is base itself is increased, it is suggestive of metabolic alkalosis. So this is a short summary about ABG, and here's a question for you. I would like the answers in comment. Thank you.